Hi, I'm Dr. Sheldon Horowitz here at the National Center for Learning Disabilities. Thank you for joining us for the next of our Ask the Expert series. What I'd like to do today is continue talking about attention deficit hyperactivity disorder, ADHD, and unpack some of the myths, some of the facts, and some of the fiction about ADHD. We've heard that people think that everyone has a touch of ADHD, and that's not true. Everyone is at times distractible, everyone is at times impulsive, but when it becomes a problem with learning and behavior in school, at work, and in social settings, we look at and think about ADHD as being neurological and genetic and being problematic, clinically significant. So each of us has features of ADHD, but not each of us has ADHD. We also hear that some people say that ADHD is the same as a learning disability. These are two separate disorders. They are co-occurring with a pretty high frequency, so as many as a third or even a half, according to some experts, of individuals who have LD also have ADHD. But ADHD, different from LD, has its root cause, its root origin, in chemical issues specific to the brain, as opposed to structural or functional images in, issues in the brain. We also hear that medication is the only treatment for ADHD, and we know that that's not true. Medication is often very important as a core part of the treatment protocol, but therapy is hugely important and effective. Coaching is also of enormous benefit. Health issues, including diet and management of stress, can also be hugely important, and other mental health issues are very important to address. So it's not just medication that makes the difference and improves the lives for individuals with ADHD. We hear from many parents that they report that ADHD was diagnosed in school or diagnosed by the teachers. The only way to properly diagnose an attention deficit disorder is with a medical provider and through a comprehensive evaluation. Physicians who know child development, who know psychiatric and mental health disorders, parents, psychologists, speech-language pathologists, anyone who has contact with the child should be feeding information in to this comprehensive evaluation. So it's not just what happens in school, it's not just based on learning, it's based on a very complete and comprehensive look at all aspects of the child's functioning. Because ADHD just doesn't happen in school, it just doesn't happen at home, it just doesn't happen in the community, it happens in all aspects of the child's life. Another thing that we hear is that ADHD always results in problems with learning and behavior. Well, that's not true either. There are individuals with ADHD who are extraordinarily competent, highly successful, and part of what enables them to do that is that they are self-aware, they know what kinds of things they do and need to be able to be successful. They have effective treatment protocols in place, so the medication that they're taking is right, the ways that they're managing stress are right, the kinds of support they've gathered around themselves are proper, and they have accommodations to help them succeed in different settings. We also hear, and this is very common, that the medication used for attention deficit disorder in treatment protocols has bad side effects. So for example, my child was a zombie when he was taking the medicine, or his appetite was diminished, or she seemed to not be growing as quickly and was of short stature and may have had sleep problems. Well, each of these issues talks to the issue of and the importance of having any medication very carefully monitored by a physician. So for example, if a child looks like a zombie, the medication protocol is not proper. There's no reason why, ever, a child should be walking around looking like they're drugged. In terms of diminished appetite, one of the classes of drugs, the stimulant class, which is often used with children with learning disabilities, is known to diminish appetite. but that doesn't mean that their appetite is diminished forever. It means while the medicine is working in their bodies, they may be less hungry. So that's why before and after, and at certain points during the day, you want to make sure that they're eating well and they're supplementing their diet so that they're not running out of energy or running out of steam. We also know that in terms of delayed growth, some children have short stature to begin with, so it may not be the medicine that's doing that. And some children may demonstrate some slowness in growth because of medication over a long period of time. But in many cases, we know that those children catch up. And if there is a decrement of any sort, it's usually a very small amount. So there are studies that actually say that children don't reach or may not reach their optimal height, but upon careful investigation, it looks like it may just be within an inch or two of their expected growth, and not even that often. And we also know that in terms of sleep problems, there are other medical issues and health issues that contribute to that. When a child is on medicine, their body is regulated in a particular way. When the medicine wears off, they may have a spike in arousal. They may rebound and then they may crash, and it may be they're very tired or a little bit more irritated. Some of the ways that you manage medication and the kinds of contact with your physician will help you know how to address each of these different areas in terms of the side effects of medication. And then finally, let me mention that some people talk about the drugs that are used in attention deficit disorder and are fearful that they may lead to addiction. Well, careful and responsible medication management over time absolutely does not lead to the abuse of these kinds of medications. If a person with ADHD is not properly medicated, they may look to self-medicate for ADHD or other disorders, and that certainly places them at higher risk for addictive behaviors. We know in the teenage years, teenagers are prone to all kinds of addictive or risk behaviors, not necessarily addictive behaviors. So you want to be very careful about how those medicines are managed during that period of time. And in terms of interactions with other drugs, alcohol and other medications, it's really important that that be part of the comprehensive medical management. Medicine for ADHD can be hugely helpful, often is hugely helpful, but just like everything else, it needs to be done very carefully with the guidance of medical professionals. Thank you for joining. If you'd like more information about ADHD or learning disabilities and other co-occurring disorders of attention, behavior, and learning, please visit the ld.org website.